5 health checkups you should skip after 70 that could harm more than help. There's a lesser-known fact that many older adults won't learn from their physicians. Each year, countless seniors undergo routine health screenings believing they're protecting themselves. But imagine if some of those standard exams, the ones your doctor insists on, might actually lead you toward operations, heart issues, or even malignancies. Recent research indicates that as much as 37% of medical screenings in older folks result in unneeded interventions, problems, or ongoing adverse effects. Surprisingly, 99% of individuals over 70 remain unaware of excessive testing. One such screening, topping our list, contributes to 5% of all U.S. cancer incidences, matching the rate from daily alcohol consumption. Clinics won't mention this, billboards won't show it, but evidence lies in the data. Today, we're revealing everything. In this video, discover the 5 health screenings to avoid post-70 and the alarming realities of their bodily impacts, all supported by solid science. And you'll be stunned by what's at number 2. Before starting, share in the comments below your location, age, and if you've ever second-guessed a test or treatment. Do you feel older adults get overscreened? We read and respond to each comment with tailored suggestions. And remember to like this video, subscribe to Senior Wisdom for more like it, and hit the bell. Now, let's dive into the first one. Why it appears benign, but might subtly diminish your well-being. Number 5. Bone density screening. Bone density screening, it seems innocuous. A fast scan, painless, no injections, and you leave informed about fracture risks. Yet, beyond 70, this often breeds more anxiety than advantage. Known as a DEXA scan, it assesses bone strength to identify osteoporosis. In seniors, particularly females, outcomes frequently indicate reduced density without true peril, since bone thinning is aging's norm, akin to skin folds or silver strands. Still, many get prescribed drugs like bisphosphonates, aimed at fortifying bones but risking grave issues such as jawbone decay, a scarce ailment where the jaw deteriorates, and throat irritation. Research reveals treating slight bone loss in those over 70 yields minimal fracture reduction. A Journal of the American Geriatric Society study tracked 1,200-plus women over 70, showing bisphosphonates cut fracture odds by just 0.3% over 5 years. Not insignificant, but hardly transformative. Conversely, side effects like gut troubles, esophageal swelling, and unusual bone fragility were more common. Consider Rose, a 76-year-old former music instructor sent for DEXA after a yearly visit. No falls, no discomfort, daily strolls. Results showed osteopenia, mild density drop, not full osteoporosis. Her doc prescribed alendronate, a bisphosphonate. 3 months later, intense reflux and jaw ache emerged. She paused piano playing. We discontinued the meds, introduced vitamin D, resistance workouts with bands, and calcium-packed eats like fish and veggies. 1 year on, she performed recitals with enhanced stability, balance, and no breaks. A brief scan might feel prudent, but for 70-plus folks sans falls or fractures, lifestyle trumps. Strength routines, equilibrium drills, nutrition, and vitamin D fixes cut fractures by 20+% per a 2022 Osteoporosis International report. Avoid letting scan figures propel unneeded therapy. But one imaging can spark something worse: cranial operations. Number 4. Brain MRI. Brain MRI for forgetfulness. As older folks notice more lapses or confusion, dread sets in of dementia or Alzheimer's, docs frequently order brain MRIs. But truthfully, these intricate brain structure images seldom deliver hoped-for clarity. For most over 70, they reveal typical age shifts like minor atrophy or white spots, standard in elders. The issue? Spotting these can ignite fear chains, extra exams, and needless surgeries that fail to boost cognition and might worsen it. A 2021 neurology study examined 3,000-plus MRIs in 70 to 85-year-olds with mild mental concerns. 86% displayed anomalies, but only 3% tied to treatable issues. Thus, 97% endured stress from "something's amiss" when it wasn't. Alarmingly, 12% faced invasive steps like lumbar punctures or biopsies from ambiguous results. Think of George, 74, ex-engineer, fretful over forgetfulness, sharp overall but key misplacements and name slips. MRI revealed white matter alterations. He feared dementia, quit driving and social events. Anxiety spiked. Reevaluation via cognitive quiz showed normal scores. We clarified the findings as age normal, shifted to sleep, fluids, puzzles. 3 months later, memory steadied, self restored. In less severe signs like convulsions, abrupt personality shifts, or swift decline, MRIs aren't ideal for mild lapses. Start with cognitive screens, basic paper tests, gauging recall, focus, reasoning. Affordable, useful, panic-free. Brace for the next, likely familiar, and ranked third for cause. Number 3, heart stress testing. Heart stress testing, common for seniors noting slight tiredness, chest pressure, or reduced vigor. This monitors cardiac response during treadmill walks or drug-induced exertion to detect artery clogs. Post-70, though, it's often detrimental, particularly sans overt heart disease signs, sparking false alerts and risky interventions. Accuracy falters, false positives hit 40% in 70+, flagging non-issues leading to angiograms, stents, or bypasses. A 2017 JAMA cardiology study noted over 50% of post-stress stents occurred in asymptomatic patients, with no survival or life quality gains, but elevated bleeding, dye-related kidney harm, extended admissions. Raymond, 75, ex-mail carrier, active walker, mentioned hill fatigue at checkup. Stress test ambiguous, led to cath showing mild narrowing, stent inserted. That evening, dye reaction caused renal issues, 6 hospital days, weeks of care. Fatigue persisted. It was dehydration, not cardiac. For 70+ without pain on effort, breathlessness, or energy dips in mild activity, stress tests risk outweigh benefits. Opt for resting EKGs, rhythm checks at rest, or calcium scans, low-rad plaque views. Safer, simpler, less procedure-prone. Number 2, colonoscopy. Unexpected, but this colon camera exam isn't wise post-70. Rarely after 75 sans symptoms. Age amps risks. Harsh prep laxatives risk dehydration, vertigo, kidney woes. Sedation threatens cognition. The procedure itself risks bleeds, perforations, or sedation arrhythmias. A 2019 JAMA internal medicine study of 1.3 million plus Medicare 70+ patients per 1,000 colonoscopies over 75, 2 lives saved versus 20+ complications, a 10-to-1 imbalance. Even found polyps are often tiny, slow. Removal in elders can harm more than monitoring. Dana, 73, bakery running grandma, symptom-free, no history. New doc pushed screening colonoscopy. Small polyp removed. Later, severe pain, faint. Hospital revealed perforation. 9 recovery days, 10 pounds lost, lasting effects. She'd had 2 prior cleans. No repeat needed. USPSTF advises halting routine screening at 75. For healthy, FIT stool tests, home, non-invasive, suffice. No prep, sedation, catches key cases. Explore options. Colonoscopy paths are sticky. Now the top overdone hazardous senior checkup. You've likely endured it. Number 1, yearly full-body CT scans. Full-body CT scans promoted in premium packages or preventative clinics as early cancer detectors. But shockingly, they blast high radiation. For 70+, they trigger needless pursuits, samplings, ops with scant life-saving proof. Each doses 10 to 20 MSV, 500 X-rays equivalent. A 2023 JAMA internal medicine model links US CT surge to 5% of cancers, equivalent to alcohol's toll. 1 in 5 malignancies from preventive scans? Counterintuitive horror. They spot benign aging spots, nodules, calcifications, cysts, igniting scans, biopsies, fear. Marcus, 80, martial arts instructor to peers, felt fine, did elite checkup. Scan flagged 3 mm lung spot, oncology referral, PET, biopsy, benign. But biopsy lung collapse meant hospitalization, 2 months heal, for ignorable nothing. ACR states no routine asymptomatic full-body CTs. Unproven gains, major harms. For symptoms like weight drop, bloody cough, lumps, targeted scans fit. Whole-body blind hunts risk self-inflicted wounds. Tune into your body. If well, stick to indicated primary checks. Time, vitality, too precious for fear-fueled overkill. There. 5 seemingly helpful but potentially hurtful post-70 checkups. Medicine's mighty, yet imperfect. Less can be more. Query next steps. If unclear or risks exceed rewards, reconsider. True prevention, activity, nutrition, rest, wise selections. Comment down below. You or loved ones face unneeded test or treatment issues? Details. We value your stories. Thanks for viewing.